Dr Ron Ehrlich joins me this afternoon. Hello, Ron. How are you?
Good, thanks, Brent. How are you?
I'm well, thank you. We've just had someone ring up with this question. I think it was Andrew that sent this to me. We passed it on to you. I paraphrased Andrew's question. He said, if I tape my mouth at night, because you and I have been talking about, you know, in previous conversations about, you know, taping your mouth at night. And Andrew said, if I tape my mouth at night and it stops me snoring, does that mean it will stop my sleep apnea? And if you say no, he wants to know why not. So if not, why not?
Okay, well, I think we've talked about sleep apnea also being a question of degree from mild, moderate, and then to severe. There is some interesting research which came out in 2015 in the Journal of Otolaryngology, Head and Neck Surgery, for those that want to look it up, which said that actually the use of tape was an encouraging way of treating mild obstructive sleep apnea and mouth breathing. And one of the reasons why that might be the case, and it might only be, it doesn't mean it is that when you breathe through your nose, your body produces something called nitric oxide, which is a really important body regulator. It's a vasodilator, so it opens up the blood vessels. It's a bronchodilator, so it opens up the airway. It has so many functions throughout the body. In fact, I think, this is digressing a little bit, Brent, but I think even Viagra focuses on nitric oxide improving circulation, but that's a whole other story. So basically what happens when you breathe through your nose, some wonderful things happen to your body chemistry, which in mild obstructive sleep apnea cases may be just enough to get you over the edge and start having you breathing properly again. So yes, it has been shown. It's some encouraging signs. And we've been using it in our practice for about 15 years with just simple micropore tape. But now there are companies that are actually producing some more elegant, if you like, a little more expensive, but still elegant alternatives. One's called Somnifix and the other is called Myotape. But basically, micropore tape can help that. Not in all cases, but in some.
Does raising your bed head help with sleep apnea?
It can do. It can do. I mean, I think we've talked about, well, sleep posture is a very important thing to consider when you go to sleep. For example, sleeping on your stomach is the worst position to sleep in because it just twists your muscles of the head, neck and jaw and your airway as well. So stomach sleeping is really bad, although it will take you 4 to 6 weeks to break that habit. Sleeping on your back is not good either, particularly for anybody anybody over the age of 30, really, because as we get older, our jaw can drop back, and our tongue's attached to our jaw, and it blocks the airway, causing us to snore or stop breathing, which is what an apnea is. So the best position, I believe, is to sleep on the side, and that has all sorts of advantages structurally for your airway, for your muscles of your head, neck, and jaw, and even for your digestion.
There you go, Andrew. I hope that answers your question. Now, Dr. Ron, you are a holistic dentist. Could you tell us this afternoon what is a holistic dentist as opposed to a dentist?
Well, I know this is going to sound really silly, almost so obvious, but a holistic dentist is one that recognizes that the patient sitting in front of them and the work that they do on that patient has the potential to affect the whole body. And vice versa. The whole body has the potential to affect oral health. So it's really recognizing that the body is connected and we're dealing with a whole person. And I know that might sound like, duh, really? Or like, what, is that so obvious? But you only have to look at the directory of any medical centre to see all the different specialties that there are, and the body's been compartmentalised into, even orthopaedic surgeons can specialise on wrists, on fingers, on feet, on knees, on hips. You know, they just deal with that one part of the skeleton. So you know, we have become so specialised, and we've spent as health professionals so much time learning more and more about less and less. I mean, we learn about our specialty, but we tend to forget that there's a whole person attached to it. And to be honest, Brent, this is something that I've been very interested in for the last 40 years, but the dental profession has been moving in that direction certainly for quite a long time now, at least the last 25 or 30 years. About middle of the 90s, there was an article, a whole journal printed on the connections between gum health and systemic health, like diabetes, like low birth weight in children, like cardiovascular disease, like osteoporosis. And now we're even learning, I've just been reading in the last week, about chewing your food, being able to chew improves cognitive function, and get this, may even be connected to hair loss, which really blew me away. So a holistic approach is really recognizing the body's connected, and to be honest, the dental profession is moving so much in that direction in the last 20 or 30 years. In my opinion, from the dentists that I know, that is certainly the case.
Tell me more about gum disease. How badly can gum disease affect our whole body?
A lot. I had a patient some years ago who was 62 years old, and he suffered from rheumatoid arthritis. He'd otherwise been very fit and healthy, supposedly. And for 2 years, he got so bad that he couldn't even get out of bed to walk to the bathroom. And his doctor thought maybe there was a dental connection, and there certainly was. He had advanced periodontal disease and a lot of dental infections. And when we eventually cleared that up, this guy not only could walk to his bathroom, but he cycled from Sydney to Perth, and then from Perth to Melbourne, and Melbourne to Sydney. Now, I'm not saying everybody that comes in and has their teeth looked at can do that, but it's just a really extreme example of how much impact, and he didn't have any dental pain, by the way. He did not have any dental pain. He just had a lot of dental infections. So it can affect your health in so many ways. Cardiovascular disease, as I said, even related to some cancers, some autoimmune conditions. I mean, Brent, we could spend a whole day talking about how connected it is to so many different health conditions.
You said no dental pain. What are the initial signs then of gum disease?
Well, one very simple one is bleeding when you brush or floss. And a lot of people come into my surgery and I say, do you floss? Yeah, I do, but if it bleeds, I don't floss for a few days and then I'm okay. So bleeding gums is a sign that there is some inflammation. And I often use the analogy, if every time you washed your hands, the cuticles of your nails bled, would your response to that be, I better not wash my hands for the next few days? Yeah. You'd probably be thinking, why are my cuticles so inflamed that they bleed so easily? And if your gums bleed when you brush and floss, that's an early sign. It's not the only sign. Bad taste is another, bad taste, bad breath is another sign. I think this is where having a comprehensive oral exam, at least once in your life, to benchmark yourself is a really important thing for people to undertake.
How do you treat gum disease?
Well, the first thing you do is identify it, because unless you know you've got a problem, I think the first thing in solving a problem is to know whether there is one or not and identify it. So that's the first thing. Identify whether you have it or not and to what extent you have it, number one. Secondly, to have a professional clean, because toothbrushing is a habit, and if you miss one spot one day, you'll miss it every day. And that spot that you've missed, even if you're cleaning 90% of your tooth surface well, that 10% that you've missed will develop into gingivitis, gum inflammation, or even worse, the deeper structures that support the teeth, periodontitis. And so having a good and thorough clean is the second thing, and then also being shown how to look after it yourself and be to encourage to put things in your mouth that feed your friends and not your foe. And that means feed the good bacteria in your mouth and not the bad bacteria. And in your gut as well, for that matter.
Are we getting better as patients at looking after our teeth over the years?
Look, it's such an interesting question. There was a report done by the ADA in the last year looking at that. And, certainly for those that access dental services there is, but over 50% of the population have not been to the dentist in the last year or more, and that is quite a shocking statistic when you consider that most dental infections have no pain. And a lot of patients and a lot of health practitioners don't fully understand this. you'll go to see your doctor, and in their assessment of your oral health, they'll go, have you been to the dentist lately? And the patient will go, yeah. Was anything done? No. And then the doctor will then say, oral health, no problem. Well, nothing could be further from the truth. So a comprehensive assessment of a person's oral health, and that includes oral cancer screening. We should talk about that another day, Brent.
Yeah.
Oral cancer screening, gum health screening, jawbone screening, jaw joints, head, neck, jaw pain, how well you sleep, how well you breathe. Are you a mouth breather? Are you a nasal breather? Do you suffer from head, neck, or jaw pain? So these are aspects that go into a comprehensive oral exam.
You said 50% plus hadn't had a dental appointment in the last 12 months. What reasons, do they ask reasons that people gave for not going to the dentist? And where I'm leading to here is, people just don't go to the dentist because they think, well, if there's something wrong, it's going to hurt.
Yes. Look, I think there are a couple of compelling reasons why people don't go. The first one is that it's a really sensitive part of the body. So, in fact, it's the most sensitive part of the body. And so opening your mouth, lying back and letting someone poke around in your mouth is not something that people come skipping into the surgery excited about. And even when it's my turn to have my teeth checked, I don't either, Brent. So there's something. So the first thing is it's an incredibly sensitive part of the body. If something needs to be done, because of that sensitivity, it needs to be done really carefully with a lot of care and empathy, and the vast majority of the dental profession are doing that. Mm-hmm. Look, cost is a factor.
Right.
There's no getting around that. And listen, to set up a dental practice, I've been in practice for 40 years, Brent, and the way of setting up a dental practice 40 years ago and what is involved now is a totally different story. When you set up a medical practice, what you need is a computer, a desk, and a stethoscope and a blood pressure monitor. When you set up a dental practice, each room I would conservatively say cost between $100,000 to $200,000 just to set up, let alone maintain. And nowadays, sterilisation procedures in the dental practice are almost at the level of an operating theatre. I mean, they are at the level of an operating theatre.
Right. Just one quick question before we go. Electric toothbrush versus normal toothbrush. What's the better? We keep believing that an electric toothbrush does a better job at cleaning our teeth than a normal toothbrush. Is that true or false?
Well, look, some people love electric toothbrushes, and they should use an electric toothbrush differently than the way they use a normal handheld brush. I personally prefer a handheld brush. Using an electric toothbrush reminds me too much of work. So people do a very good job using the old-fashioned toothbrush, and people do a very good job using electric toothbrush, but you need to be shown how to do both properly.
And you've got to floss how many times a week?
Well, you floss each once a day.
Once
it's
a
best
day.
to, at night, you start off, have a rinse out of your mouth to get rid of any loose food. Then you floss carefully and rinse out, and then you brush your teeth, and then you rinse out. And you do it in that order, but flossing once a day is ideal.
Does keeping the toothpaste in your mouth, does that do any good for you, rather than spitting it out?
Look, that's an interesting question, Brent, because there are some sensitivity toothpastes which I actually think probably would help when doing that, just keeping it in the mouth for about 30 to 60 seconds. Look, I think the main thing in brushing is to physically move the bacteria off the surface of the tooth. And the toothpaste is really secondary, I believe. I know there are lots of ads about this being, the toothpaste to end all toothpastes, but it's essentially about physically disrupting the harmful bacteria that start to cause gum disease and tooth decay. So take your time. Use toothbrushing as a mindfulness exercise. I love multitasking, Brent. So if you can practice mindfulness for 2 minutes twice a day while you're brushing your teeth, you're killing two birds with one stone.
You are. Thank you. It's always a delight to chat with you. We've got to go to the news. We'll talk to you next week, Dr. Ron.
Thanks, Brent.
Ron.